Okay, welcome, folks. This is David Rawson, founder and president of the Canadian Academy of Clinical Sleep Disorders Disciplines. Welcome to our 19th webinar. Dr. Dennis Bailey, of course, is no stranger to us. This is his third appearance on our Wednesday webinar series. Dr. Bailey is a general dentist with a practice limited to the management of sleep-related breathing disorders, utilizing oral appliances as well as temporomandibular disorders, orofacial pain, and related headaches. He's a graduate of Indiana University School of Dentistry and completed a general practice residency at Miami Valley Hospital in Dayton, Ohio. He's a past president of the American Academy of Dental Sleep Medicine, 98 to 99, is founder and past chair of the Oral Appliance Section, and served on the Standards of Practice Committee for the American Academy of Sleep Medicine. He frequently lectures both in the United States and internationally, and has authored numerous articles and chapters on the topic of sleep medicine and on the use of oral appliances by the dentist for the management of snoring and sleep apnea. Dr. Bailey has brought us two very informative presentations of different subjects in the past, and tonight his topic is the gut biome, the second brain. Welcome back to Canada, Dr. Bailey.
Thank you, David, as always. This may seem like a strange topic for dentists to be talking about the gut, but I want to give you some introduction as to why I think it's very important. This started for me back in 1998. In 1998, I was introduced or became aware of a textbook on the second brain, written by Michael Gershon, who was a gastroenterologist, MD, and he began publishing or discussing the fact that our gut had a significant impact upon how our brain and how our body or how our health was affected, and particularly it's how it affected the brain. And of course, this is really in the early days of sleep and sleep medicine and sleep disorders. But Dr. Gershon was looked upon as being somewhat of a heretic. Actually, he became very chastised by the gastroenterology groups and was actually thrown out of many of the learned societies. But when I read his book and understood what he was talking about, and having some knowledge of some of the mechanisms of the brain and pain and some of those different things, which we'll discuss a little bit of, it became very clear to me that he had somewhat of a rational idea, although it was very much in its infancy, as to how the gut interacted with the rest of our body, and particularly the brain. So let's take a look at the overall health in the gut. There is growing evidence that gut health is critical to overall body and brain health. It's not just about gastroesophageal reflux disease or GERD or gastritis or whatever you might want to call it, reflux or IBS. It's also bidirectional, and altered sleep patterns and hypoxia, particularly with OSA, lead to an alteration in the microbiota or the bacteria that exist within our guts. And this can lead to an alteration of immunologic activity within the body. It can be connected to both blood pressure and to Alzheimer's. And as I have done in all of my presentations, I try to present you with as many of the resources and references of an evidence-based nature as possible, so that you have an idea should you wish to go back and check on some of these at some point in the future. Well, we know that the gut microbiota and health and sleep are all interrelated. It can begin with asthma. It can relate to heart disease or cardiovascular disease, to obesity, to diabetes, and even to dementia. The microbiome of the human play a role in all of these in terms of pathogenesis. Now, many of these studies were not done in humans. Initially, the studies, and even today, many of the studies are animal studies. A lot of them are done in mice and rats. But there are many studies that I cite here, this one in particular, out of the University of Alberta, in Sleep Medicine Reviews just last year, late last year, showed that this was actually the case. There's a diurnal rhythmicity related to the feeding and fasting cycle. And what that means is that what they've discovered is that the time of feeding, the time of eating, the time of meals, and the time of fasting tends to have a marked impact upon the gut microbiome that exists within our bodies. This can be related to the HPA axis, the hypothalamic pituitary adrenal axis. And that leads to a stressful relationship. So when there's stress, we tend to see more cortisol levels released. And as cortisol is released, it interferes with our sleep, which has an impact upon the hypothalamus, which of course is the major center for the release of neurohormones or neuropeptides that are responsible for both sleep and wake. Probiotic supplements, and all of you, I'm sure, attending this are familiar with probiotics that are sold in health food stores and grocery stores and a variety of other places, are done to improve subjective sleep quality. The problem is, as is pointed out in this article, is that trying to identify the specific bacteria, the specific strains that are necessary to achieve the proper result is not always the easiest thing in the world. I'm going to give you some samples or examples of what those bacteria might be. This is just a cartoon that is designed to kind of illustrate what the previous slide was talking about. Here we have light, which enters the eye here. It directly goes through the ophthalmic tract from the retina to the retinal hypothalamic tract to the SCN. The SCN, as we all know or should know, is our major center of the body's internal clock. That can be impacted by the gut microbiota, which, as I pointed out before, is impacted by feeding times, eating times, and has an impact upon all of our body, from the stomach to the intestinal area to the liver and to other organs such as the pancreas and even blood vessels. And they all have their own specific peripheral clocks or circadian clocks that relegate it. The stomach is different than the liver, which is different than the pancreas, which is different than other organs of the body. For instance, GERD, gastroesophageal reflux disease, is most prevalent between the hours of 10 p.m. and 2 a.m. We have the greatest amount of motility within the gut, mostly here, not the stomach, but in the gut, that occurs during that period of time. But of course, the reflux occurs from the stomach. We'll talk more about that. So we know now that sleep deprivation and the gut are connected. It's known, and this is from a Harvard study that was published in the journal Cell back June last year, so a year ago. And it was published online. So it's a very interesting study because there's actually videos that go along with it. And it's known that premature death can be caused by sleep deprivation. It's been known for a long time that if we deprive an animal or we deprive humans of sleep, eventually that sleep deprivation can potentially lead to death. This appears to be related, the Harvard study says, to an increase in reactive oxidative species. That's what ROS stands for, reactive oxidative species. We know them as free radicals, which occur in the gut. This can cause damage to our DNA and can result in cellular death. But it can be neutralized with antioxidant compounds. And the interesting part of the study that was published in the journal Cell indicates that one of the most potent ways to alleviate the presence of the reactive oxidative species, the antioxidants or free radicals, is with melatonin, supplemental melatonin. You can also use lipoic acid, and there's a number of other products that they mention, but the melatonin is the interesting one. And I bring melatonin up because if we study melatonin or we look at the qualities of melatonin, we all think of melatonin as being a sleep aid. It's not a sleep aid. It's a sleep inducer. Melatonin ideally should be taken about dusk when melatonin from the pineal gland of the brain is naturally secreted. Remember, it's a hormone. It is not a neurotransmitter. And as such, melatonin is released at the time of dusk when the light penetrating the eye is not as intense. So it opens up the gate for the release of melatonin. The release of melatonin, in turn, has an impact or effect upon various regions of the brain that are most impacted by sleep. And so what it does is it sets up, this was also published in the journal Cell as a study that was done on zebrafish some years ago. It also sets up the brain as a mega receptor so that the various neurohormones and chemicals that are responsible to induce sleep are available to the brain, and it improves the uptake of those neurotransmitters and chemicals. And I'm speaking specifically of adenosine and of GABA, GABA aminobutyric acid. We'll talk more about that one as we go along. So melatonin can play a very prominent role. My last comment about melatonin is, which is little known but should be appreciated, is that melatonin, besides being an active compound that can impact our sleep, is also a very potent antioxidant, anti-inflammatory. And so as such, it helps to reduce the inflammation that's there. And we're going to be focusing a lot on inflammation as we go along. Now, in case you're not familiar with oxidative stress, this is basically a broken down diagram of it. It's not the complicated diagram. So I took and reduced that complicated diagram into a more simplistic form, but let's follow along. So we have OSA, and we have episodic, or what's called intermittent hypoxia. You're going to see various slides here that say IH, that's intermittent hypoxia. And so that leads to what's called reoxidation. We're trying to get more oxygen into the system, but that leads to free oxygen radicals or free radicals or reactive oxidative species. That's the reactive oxidative ROS that you see here, which is increased. Reactive oxidative species are a critical factor in cardiovascular disease, diabetes, atherosclerotic disease, and even periodontal disease. That leads to the activation of lymphocytes. So lymphocytes, which is a white blood cell that's important to recognize it. Let me start over. I'm really not having a Biden moment. Lymphocytes are really activated, associated with inflammation. That leads to adhesion molecule expression, or what is typically referred to as platelet agglutination. So platelets are more readily going to agglutinate or attach themselves to the epithelial wall. Monocytes and lymphocytes and endothelial adhesion begins to occur. So there's a breakdown in the endothelial layer of the blood vessel. This leads to endothelial dysfunction. This is where we get basically the clots, or we get the breakdown of the wall, and it can lead to vascular disease, which of course leads to various other sequelae such as stroke. Now, all of this is mediated through nitric oxide, not nitrous oxide, nitric oxide, NO. And nitric oxide during this intermittent hypoxia is reduced. And so the diminution of nitric oxide is a feedback factor to the endothelial adhesion and endothelial dysfunction, because nitric oxide is a potent vasodilator to increase the size of the vessel. Thus, we don't have any endothelial dysfunction. I hope that kind of, in a broad sense, illustrates it. Okay, so let's go back to GERD. GERD is a critical factor in all of this, because patients who have acid reflux, gastroesophageal reflux disease, are also more likely to also have sleep-related breathing disorders. So what's the mechanism? Well, the mechanism is that during negative inspiratory pressures, there's inflammation, and this occurs a lot with obesity. So typically, these patients tend to be a little bit more overweight. They may have more abdominal girth. Not always, but typically. There's an increase in intrathoracic pressure that affects the phrenoesophageal ligament. So in other words, with the negative inspiratory pressures that are occurring within the respiratory tract or the upper airway, it also has the same effect upon the esophagus. And this affects the phrenoesophageal ligament, which is right here, the sphincter, where the esophagus enters the stomach. connected to the esophageal sphincter. So right here is the main area. And this can then have other relationships, because with the relaxation of the sphincter, we can get regurgitation, as you see on the right here, of stomach contents or acids. It can be liquid, it can be gas, up into the esophagus. And this can get back up into the lungs and create an asthmatic condition, which has been shown by National Jewish Hospital in Denver. It can create an allergic type reaction. I'm going to talk a little bit about allergy and what's called the allergic march, or the atopic dermatitis, and the nasal airway obstruction, even as far up as into the nasal cavity. That tends to be a little bit controversial in some people's minds, but I've seen cases of that where patients got their acid reflux and GERD under control, and this resolved. Now, there's two types of acid reflux. There's symptomatic and there's acidic, or symptomatic, which is also called acidic. That's the heartburn, that's the need for some type of a proton pump inhibitor or some type of an antacid. Then there's non-acidic, which is also called silent reflux, and this is more common, associated with proton pump inhibitor therapy, whereas the symptoms of the reflux may appear despite the persistent treatment or the efforts to treat this condition. Now, the interesting thing about this silent reflux is that with silent reflux, we tend to have symptoms of it or signs of it without necessarily the acidic type symptoms we see with symptomatic. So in other words, with silent reflux, you may notice various things like irritation or inflammation on the posterior aspect of the oral pharyngeal cavity. You may notice a pasty coating in the posterior third of the tongue. And again, the nasal congestion or allergic type reaction can also be present. You'll also have basically two other factors related to voice. One is more of a gravelly voice or more of a irritation of the vocal cords, which creates a change in voice. And you can also have a slight symptomatic cough that can exist with silent reflux. This goes back to 2007. This guy right here, Bill Orr, is my main man. He's the gentleman that I learned from so long ago, actually well before 2007, but has done the most to publish on this particular phenomena. Now, the incidence of GERD, about 7% of adults have daily symptoms, 20% have symptoms once weekly, and obesity tends to be a key factor. Why obesity? Because in obesity, particularly when there's central obesity or abdominal obesity, this tends to put more pressure on the esophagus and the diaphragm, which tends to create more of a regurgitation type phenomena. Despite medication, only 49% had their symptoms controlled, and 54% of events during sleep are followed by awakenings, and 90% associated with sleep disruption. So we know that acid reflux can be a major factor. So the relationship between OSA and GERD from a meta-analysis is a significant correlation between OSA and GERD. And I'm leading into the microbiome and the microbiota because that's what exists in our intestinal tract. And if it gets upset, which I'll share a term with you called gut dysbiosis, that creates more of a sensation of GERD or a outcome of GERD. The meta-analysis looked at 7 articles, 2,600, almost 2,700 patients. The odds ratio for association between OSA and GERD is 1.75. It's almost 2 times that of the normal population. And presence of OSA and GERD persisted in 38.9% of the population. So it is a major factor, and it's something we need to be inquiring of our patients or trying to find out from our patients as to whether or not they have it. So I threw this slide in just as a matter of education. There's a thing called the Dunning-Kruger effect. And in short, this says the less you know, the less able you are to recognize how little you know, so the less likely you are to recognize your errors and shortcomings. For the highly skilled and the likely like trained scientists, the opposite is true. The more you know, the more likely you are to see how little you know. All right, let's talk about the gut microbiota because we're looking now at the second brain. And we're going to look at what's called the gut-brain axis. So there's over 1,000 types of bacteria that make up the gut microbiome. Okay, so if you were to pick up a bottle of probiotic at any pharmacy or any health food store or wherever you pick it up, you're going to see there's all kinds of different things in there. They're not all necessary. It's actually overkill. We need to start honing in on the ones that are most important to us based upon our symptoms or based upon our concerns. There's roughly 30 trillion human cells in the body, 30 trillion. And there's approximately 39 trillion microbial cells. So you can see that the gut microbiome is an overwhelming amount of bacteria in and around our bodies. So we're made up of these consistently and constantly. But we have a significant amount of microbiome diversity, and it varies between the skin, the palm of the hand, I'm talking about the skin, the general skin, the tongue or the mouth, and you think about cleaning the tongue or about periodontal disease, the airway, and of course the gut, which is in the gut, it's mostly measured by fecal material. So they do an analysis of fecal material. And many of the articles that I researched over the years looking at this whole process all came from researching the microbiota that existed in the fecal material, because that's how they can really assess it. They don't go into the large or small intestine. The problem is the antibiotics will affect the microbiome. So anytime we're put on an antibiotic, it's going to upset our gut. It's going to upset these microbiota. It's going to create an imbalance called a dysbiosis of these gut bacteria. And so this leads to other types of or other kinds of health problems. This is just a cartoon overview. You can't really read this real well, but this is just meant to give you sort of a bird's eye view of what I was just talking about. The oral cavity, the lungs, because the airway is also affected, the GI tract, and of course the skin. So all of these areas, and also we need to include in the lungs, or I would make this more generally the airway, we need to be cognizant of the nasal passages as well. So what I pointed to before, the gut-brain axis, we know exists. This is related to our microbiota, and we know there's influence on the motility of the gut, secretion, nutrient delivery, or how much we're going to extract out of the food we eat, and the microbial balance, or the balance of the microbiome. We also know that the gut affects our brain because it's going to have an impact upon the neurotransmitters that are responsible for daily existence, particularly with sleep and other things related to sleep pathologies, stress and anxiety, and this goes back to the HPA axis. It affects our mood, it affects our behavior as well, okay? So hopefully we're getting a kind of an overview of where this is going. Now, just to give us sort of a basis of terminology, there's both prebiotics and probiotics. Prebiotics, that's not something you buy at the pharmacy. That's something you buy at the grocery store. These are the foods we eat to nourish the gut. We'll get into a little bit more of that as we go along. So prebiotics are not the bacteria themselves. They're what the bacteria are going to metabolize to actually create more healthy bacteria that are going to recreate the gut microbiome within our bodies. Probiotics are those supplements. Those are the supplementation of the bacteria to replace the bacteria in the gut. Good, bad, or indifferent. Again, it may be overkill, but that's what it's designed to do. Gut dysbiosis is the imbalance of the good bacteria in the gut. So if we don't eat the right foods, and the bacteria that are present, or the microbiota that are present within our gut, doesn't have the ability to renourish itself, then the good bacteria cannot exist, the bad bacteria take over, and that through the gut-brain axis leads to other health-related problems. So it's related to a variety of health and medical disorders. And these can include sleep, these can include sleep in the brain. Now, I want to share with you a phrase that a colleague of mine had on a presentation a number of months ago. Sleep is for the brain, of the brain, and by the brain. Keep that in mind. Sleep is for the brain, of the brain, and by the brain. So everything we do with sleep is regulated by the brain in one way or another. Now, which brain are we talking about? So in this presentation, I'm trying to get you to understand that our second brain is also very important, because through the gut-brain axis, it has a critical role to play. It also can affect cardiovascular disease and blood pressure. It can affect asthma, as I pointed out, fibromyalgia. and dementia and other neurologic disorders. We're going to discuss many of these in a more overview, generalized sense. So prebiotics come from the foods we eat, which I mentioned. And this is especially true of foods that are considered to be fiber in nature. And other foods that we may look at, the legumes, such as beans, peas, and chickpeas. And I'm only giving you a few examples, not all of them that are in the literature. Various whole grain cereals, such as oats, bran, rye. And there was a very informative article that came out last year that showed conclusively that consuming rye in whatever form, whether it's in a form of a bread or some other type of, whether it's a cereal or some other type of supplement, has a significant effect on reducing inflammation. I found that to be very interesting, especially when I was going back to research all of this. Fruits such as berries, banana, olives, and particularly olive oil, vegetables such as garlic and onions, nuts, seeds like pistachios, almonds, and flaxseed. All of these often contain a byproduct called inulin. Well, that's not insulin, that's inulin. So what is inulin? Well, inulin is fermentable fiber, and it's the fermentable fiber that is broken down by the good bacteria to help foster the production of more good bacteria within our guts. So it's things like whole wheat, onions, garlic, banana, asparagus, and artichokes, all things that I've mentioned. It's a type of oligosaccharide or fructan, which is a chain of fructose molecules. So it's the sugary substances, but it's not the sugar like glucose or like actual sugar products. It's actually fructan comes from the byproduct of various food substances, fruits and vegetables. Inulin can cause the feeling of fullness, which in turn aids in weight loss, because if you don't have this feeling that you're still hungry and eat more, you may have a chance for losing some weight. It also has the ability to help with lowering our cholesterol and impacting our LDLs. So it has a very positive feedback. However, foods with inulin, this is interesting, are not good for people with IBS. I mentioned IBS with GERD, but IBS is a whole different animal. And part of the reason is because the inulin in IBS patients tends to draw more water into the system, which can have an irritating effect upon the gut. Then there's butyrate as a prebiotic, and it's a short chain fatty acid, which is produced by the gut bacteria from foods with fiber. So fiber comes into play again. And there's certain foods that have butyrate as a byproduct of this production or this metabolism associated with fiber. And foods to consider in this category are things like almonds, apples, kiwi fruit, garlic, wheat, and oat bran. And you can see that there's an overlap of these various chemicals that are responsible for gut health that we get from various foods that we consume. They found that high protein, high fat, and low carb diets have the opposite effect on the gut microbiome. So they create this gut dysbiosis that's an imbalance of the good to the bad bacteria. Non-fiber prebiotics are being investigated. So at this point in time, these are basically what are called polyphenols, and they're considered to be what, in quotes, is a lifespan essential. These include things like flavonoids, which are basically certain fruits and vegetables. Again, you find flavonoids in colorful fruits and vegetables like berries and black tea and citrus, even in red wine. Chili peppers, resveratrol in red wine and in white tea. White tea is loaded with polyphenols, which is very good for our good bacteria. These are potent antioxidants and they reduce inflammation. So the polyphenols are working a little bit differently than some of the other prebiotics, the non-fiber or the fiber ones, because what they're doing is they're creating basically a polyphenol, which has a different effect upon inflammation. They fight various diseases such as diabetes, obesity, cancer, control blood pressure, and they are very much involved in activating the immune system. And then polyunsaturated fatty acids, like things that are found in some fish, and various oils like saffron and others, as well as nuts, also have an impact, which contain the omega-3s and 6s. So these are all important to our prebiotic non-fiber supplementation for the gut and for the good bacteria. prebiotics for GERD. Now, this is interesting because this is an emerging and developing area of interest. And what this is all about is it's trying to control the harmful bacteria that may be responsible to some degree for GERD as well. And so with gut dysbiosis and of course the acid-related injury that occurs. Now, if we think back, actual prebiotics that I've been talking about have been missing in our diet for about 50 to 100 years. So we're just now catching up to where we need to pay more attention to various dietary considerations, as many people do. You talk about the Mediterranean diet, you talk about vegan diets and so forth, but everything needs to have some goal in terms of replenishing or feeding the good bacteria. Microbiome in the distal esophagus differs in those with GERD. So the upset or gut dysbiosis that occurs in the distal esophagus is seen and associated with GERD. So we're basically getting a breakdown in that area that's lending itself to the maintenance of GERD. The idea is feed the good bacteria and destroy harmful ones and reduce the inflammation. Now, this was found in an article or an abstract in Digestive Disease Week by a Dr. Selling, and it's a company called ISO Thrive. And ISO Thrive right now is working on a series of actual prebiotic supplements that can be used, or I don't know if there's so much supplements as just something you would ingest, but can have the same effect as some of the various foods. Probiotics now are live strains of good bacteria, and they must be consumed live. One of the problems with many of the probiotics is that they are not consumed live. Some of them are not live bacteria, so therefore they don't do as much good. Where you can find more of your live probiotics is in yogurt. There are some cheeses, particularly Swiss cheese and others. Sauerkraut has it, as do pickled vegetables. I thought to myself the other day, pickled vegetables, that's interesting. My wife loves her dill pickles that are pickled in they're not very tasty to me, but maybe they're doing some good over their biome. Bacterial strains are the most beneficial, are well researched. And I listed here the bifidobacteria. It's abbreviated B. animalis, B. lactis, lactobacillus, lactobacillus acidophilus. We've heard of many of these, and these are the ones that are the most beneficial in terms of bacterial strains. So I go back to what I said before. They're beginning to isolate out various strains, not just a shotgun approach like you see in the grocery store, but isolating out various strains that may be beneficial to us. How this is going to come about, I have no idea at this point. There are many people who are presupposing that this may come about by doing samples of stool. There may be other ways with saliva. No one knows at this point in time. Now, how about the gut and sleep? Well, sleep fragmentation and short sleep are associated with gut dysbiosis, may lead to activation of this HPA axis, and that, of course, is associated with stress. And we all know that stress can have a marked impact upon our GI system. We can get upset stomachs, we can get some GI distress, we can get a variety of things going on. So the HPA axis and the gut-brain axis are interrelated to some degree, or potentially are interrelated. This follows a circadian rhythm, the light-dark cycle, and the feeding cycle. Now, this becomes very important. And it becomes more important when you consider that there's a connection that is related to jet lag and shift work. So people who have jet lag, who may be eating at off hours or not, the circadian rhythm of their gut is not in sync with their actual time clock, this may be upsetting to the gut microbiota or the microbiome, and actually increasing more of the bad bacteria as opposed to the good bacteria. And sleep loss leads to this increase in inflammation that can be mediated through the microbiome. But more importantly, it's related to 5-HT or serotonin, levels that impact melatonin. Now, what we need to know, or we need to remember, is that the gut is our main source or the biggest source of 5-HT. 5-HT comes from three sources. The primary one is the gut. The secondary one, or the other two, secondary one really is the brain, and the tertiary one is our platelets. And so if we review 5-HT and what it's all about, It's a wake neurotransmitter, but also active with non-REM sleep. So in non-REM sleep, 5-HT impacts specific receptors in the brain, whereas in the wake, as a wake neurotransmitter, it's impacting other receptors within the brain. And 5-HT is also very important when you consider things like migraine and you consider pain disorders. 5-HT has many, many different components to it. There's many different variations of 5-HT that come into play. The microbiome is affected by high fat and sugar diets, which in this can lead to obesity, may result in a breakdown of intestinal epithelium. And that's what the term leaky gut means, is that the intestinal epithelium no longer have a good integrity, and the cells tend to separate, allowing for these byproducts to get out into the normal system. So in this article in Sleep Medicine Reviews, which is what I've been citing in the previous three slides, their conclusion is that shortened sleep is associated with a multitude of illnesses that activate pro-inflammatory pathways and culminate in premature mortality, similar to what the Harvard study showed, in that there's a cellular death and there's an increase in reactive oxidative species. The gut microbiota is a strong candidate for initiating this link between dysfunctional sleep, disrupted body rhythms, or alteration of the circadian rhythm, and of course, poor health. And that relates to all kinds of things. So the gut microbiome diversity in sleep, the microbiome diversity associated with sleep and sleep efficiency and total sleep time, TST, total sleep time, is negatively related to sleep fragmentation. But in other studies, that's not the case. Possible that the microbiome and other physiologic changes lead to poor sleep quality in older people. Now, could it be that the alteration in this microbiome or gut dysbiosis is actually related to, say, acid reflux, which we saw before can result in poor sleep quality in 30-some% of the population? Could be. There's other realizations that we need to be aware of. Specific microbiota found to produce GABA, thus promote good sleep. And that's what this slide is designed to show, is that there is an interaction between the gut and the brain, again, the gut-brain axis, that actually produces GABA. So this just says GBA, but it should be GABA. And the GABA interaction to the brain, preparing the sleeper, our main neurotransmitter of sleep, is at play here. So it's not just that the microbiome are affecting us in some way that disrupts our sleep, but there's actually an impact upon the neurotransmitters that relate to producing our sleep. Now, just as a matter of course, just to bring you back some review, let's just briefly review the neurotransmitters of wake and sleep. The main wake alerting neurotransmitter is histamine. This is referred to as the neurotransmitter of quiet wakefulness. We also have acetylcholine, which is for wake and REM and EEG desynchronization. So we see this during wake and REM sleep. This is part of the reason why REM sleep is referred to as paradoxical sleep, because with acetylcholine, we see similarities in terms of the neurotransmitters that are working, as well as what we see on an EEG. Dopamine, glutamate, hypocretin orexin, norepinephrine, and here's serotonin in both places, once again, because at specific receptors, mostly during non-REM, it's active. In sleep, we have adenosine and GABA, and remember that melatonin is preparing our brains, the receptors in our brains, for adenosine and for GABA. This is the main CNS inhibitor, so it basically reduces the activity of our wake alerting neuropeptides, and adenosine is responsible for basically creating or initiating our sleep drive. Glycine, which is inhibitory, causes the muscle atonia, mainly that's associated with REM sleep, and melatonin, which is a hormone which I mentioned before. So just a brief review of those neurotransmitters. But going back, remember now that the gut microbiota, specific microbiota, are found to produce GABA, which produces good sleep. So there is a relationship. Sleep fragmentation, blood pressure, and the microbiota. Sleep fragmentation is known to affect blood pressure. It's associated with the gut microbiome. It's also related to short chain fatty acids, which increase obesity. And remember that one of the things that is in the literature about blood pressure, which tends to rise when patients have poor sleep and tend to be more overweight or obese, is really a factor. One of the things they tell you to get your blood pressure under control is lose weight. It can impact autonomic function, particularly, with the sympathetic nervous system. Found neuroanatomic communication between the hypothalamus and the gut and to cardiovascular regulatory centers in the brain. So there is a communication here that exists between the hypothalamus and the gut. Also, this gut dysbiosis is associated with hypertension, which is often seen in OSA. This is from rat and human studies. This study just helps to support what I've been saying before. And related to a high-fat diet and specific bacteria that were affected. And it listed some of the specific bacteria. I didn't want to get into listing out all these different bacteria that were there because that might have a meaningless effect upon grasping the entire concept of what this is all about. It's related mainly to the plasma lactate levels that are there, which involves the short chain fatty acids. It's also related to elevated sympathetic activity, which we've known for years, which is also increased during systemic or is associated with systemic inflammation and directly related to this IH. And again, intermittent hypoxia becoming a key factor. Circadian rhythm in the gut. They also have their own circadian rhythm, as I pointed out before. It's impacted by diet as well as time of feeding. This time of feeding is a critical factor. The time that we actually eat our meals, the times that we actually indulge in our feeding has a marked impact upon gut activity. So eating late night meals can be bad. And that's when our circadian rhythm is affected. Basically, most people are aware of the fact that if I eat my meals way too late or I have a late night meal, it's going to affect my sleep. And part of the reason is because with eating, depending on what you're eating, may affect the microbiome, which is going to have an impact upon our circadian rhythm. And so this irregular eating and late night eating, you have to consider jet lag, shift work, and of course the free running clock. Shift workers are known to have higher risk for cardiovascular disease, obesity, and cancer, specifically breast and prostate cancer, because shift workers are having their, quote, lunch at 2 a.m., for instance. You think about all those people working at Amazon overnight to get the shipments out. All of this comes into play. So the circadian rhythm and gut, we're going to continue it. One common feature is the inflammatory process increases in pro-inflammatory bacteria. The intestinal barrier dysfunction or the leaky gut, this promotes inflammatory mediated diseases because it gets into the general system. And stage of life can be a factor. And this cartoon out of this article basically shows that from infancy here, even before infancy in utero, all the way up to old age, our gut microbiota have a change or alteration in the demands that are on the system. In other words, the propensity of which ones are present and more active changes as we age. Gut microbiome and OSA, there's a bidirectional relationship between OSA and microbiota. It's influenced by sleep fragmentation, the intermittent hypoxia, and hypercapnia, all of which have an effect upon our pro-inflammatory mediators. It's related to OSA and, of course, cardiovascular disease as well as obesity. The upper airway microbiome may be associated with periodontitis in the oral cavity from their microbiome. So it's been found that if there's an alteration or actually a dysbiosis of the bacteria associated with periodontal disease that's being either ingested or breathed in or in some way released into the upper airway, that can have an effect upon OSA and upon the airway itself. It's also associated with a microbiome of the nasopharynx and the oropharynx. And we can manage this with prebiotics and probiotics. In severe OSA, more bacteria gram-negative in plaque samples. This was found in this study here from just this year in the Journal Sleep. They showed that by sampling the plaque samples of patients, particularly those with more severe periodontal disease or periodontitis, that this actually had an impact, and it shows the relationship that exists between OSA and periodontal disease. In pediatric OSA, adenoids and tonsils have crypts where bacteria may grow. This becomes a factor in OSA in these children. So we have a dual problem here because we've known for years that OSA in children is related to adenotonsillar hypertrophy, but there's also now a recognized relationship to a dysbiosis associated with the crypts in these structures harboring harmful bacteria that get into the airway that are responsible also for much of the relationship to OSA. And also found role of microbiota on OSA associated with blood pressure. So with resolution of the OSA gut dysbiosis, which occurs through the use of probiotics and prebiotics, this may continue. So it's a factor in OSA-related comorbidities. Microbiome in the nasal airway, well, they looked at the nasal airway, and you all know from my previous discussions how I stress the importance of the nasal airway and nasal breathing. We talk about the nasal airway and the importance of it because of the release of nitric oxide, which not only is a vasodilator for taking in more oxygen, but it also is a potent anti-inflammatory, antibacterial as well. The nasal microbiome have an influence on OSA. Again, similar to what we talked about with the plaque, with periodontitis, with the adenoids, and with the tonsils, where these bacteria now can get into the airway, can get into the gut, and have a dysbiotic relationship, thus contributing to the alteration in the circadian pathways which lead to OSA. Alteration in nasal microbiome may be related to acute respiratory tract infections, allergic rhinitis, and they relate these to asthma. Again, it getting from the nasal passages into the airway can be breathed in, creating more asthmatic symptoms. And these can actually be helped by probiotic use. Now, in my studies, what I came across, here's a probiotic nasal spray, here's a probiotic rinse, similar to the sinus rinses that one might use. So this is a, on the horizon, developing area of interest in terms of dealing with the nasal effects of the microbiome as well. One interesting fact about the nasal microbiome is that even with the use of CPAP therapy, it was found that the nasal microbiome did not stabilize. If it was out of sync or out of, it was a dysbiotic relationship, that nasal biome was not going to be affected by simply using CPAP. And so that I found very interesting, because what that means is that although CPAP is helping us or may help the patient in improving their OSA, quote unquote, by virtue of AHI or whatever they're measuring it by, that's not improving the nasal microbiome, which can now continue to affect it and may account to some degree for why some patients just don't feel an improvement with nasal CPAP. They just don't do better. Yeah, the numbers get better, but the patient doesn't get better. And so we have to look at all aspects of it. There's an association to dementia, and AD stands for Alzheimer's disease. Remember, Alzheimer's disease is a form of dementia. It's a type of dementia, because we have other forms of dementia like Lewy body dementia and others. So we have to make sure we're not very specific, but understand the differences. Gut microbiota may have a role in Alzheimer's disease development. This dysbiosis may relate to what's going on, because with aging and gut dysbiosis, this can lead to permeability of the gut, again, the leaky gut, and it can affect the blood-brain barrier. So through the vagus nerve, which connects the gut with the spinal cord through brainstem nuclei, we may actually be getting an effect of this gut dysbiosis on the brain. And it's possible that with the leaky gut phenomena, the microbiota actually produce neurotoxic substances or pro-inflammatory cytokines and ammonia, and these are released into the brain. And so studies are showing, like this one, that this may be a real factor. So the microbiota diversity found, comparing controls, normals, and dementia and AD patients, they found they had less of this type of bacteria from Firmicutes and increased Bacteroides found in AD. And there was a direct difference. Bacteroides was lower in dementia patients, higher in AD patients, lower in dementia patients, excuse me. So one thing they found, hitting the wrong button, Heliobacter pylori or H. pylori was found with AD. via massive increases of inflammatory mediators. So not only are we getting the microbiota, these neurotoxic substances, which are getting into the system and crossing the blood-brain barrier, but we're also getting chronic neuroinflammatory situations that are associated with amyloid production that's responsible for Alzheimer's disease. So improving the gut microbiome may slow the progression of Alzheimer's disease. This is a whole new world that's opening up in terms of not only preventative techniques, but in techniques that may have a marked impact upon the diseases themselves and how we may be able to control them. Parkinson's, another neurodegenerative disease, which is linked to some degree with dementia and Alzheimer's. Many patients will have symptoms of constipation, which may precede motor symptoms by almost 20 years. Alpha-synuclein pathology is evident in the gut. This is the byproduct that is found in the brain that is associated with Parkinson's disease. Not only is it a situation with dopamine, but it's also related to this pathology. The gut may be the starting point, so we need to look for non-motor signs in patients who may be at risk for Parkinson's, such as loss of smell and taste, and of course, REM behavior disorder. REM behavior disorder is a big one where people have a tendency to act out their dreams. The vagus nerve here is also involved, and it's shown to have a rostrocaudal, meaning that it goes from the gut to the brain. So it's the gut-brain axis again in its progression. And they also looked at vitamin D deficiency, which is now being seen as an actual concern. And there are articles out there. There's one in particular that I researched. I don't have it in the slides, which actually showed that vitamin D supplementation or measurements are critical to the microbiome. So it starts with the skin. It starts with the production through the skin of vitamin D, which affects the intestinal microbiome. Parkinson's disease in the gut appears to be associated with sleep bruxism, TMD, taste issues, and burning mouth syndrome. So as dentists, we need to be looking for these things as precursors to Parkinson's. Dysphagia may be a sign, difficulty swallowing or difficulty with swallowing food or water. H. pylori, again, is also implicated, and the gut dysbiosis may impact the absorption of the Parkinson medications. So all of these things become factors. Microbiome and fibromyalgia, or I'm going to label it FM here. A variability in gut microbiome was the main variable in fibromyalgia. In this article here, which was ahead of print, came from McGill University in Montreal. They showed that of all the things that they looked at in this study, of all the different factors related to fibromyalgia, the gut microbiome was the one that was most consistent. I thought that was pretty remarkable. FM shares clinical features with IBS and chronic fatigue, and several specific microbiota are involved with arthritis and also implicated with fibromyalgia as well. And microbiota in infant development. The mother's microbiota impact the development. It takes several years for child's microbiota to fully develop and diversify. The factors for the mother and child could be antibiotic use during pregnancy or child's early part of life, can be diet, what they feed the child or what the child may not be ingesting, and of course the use of breast milk. And of course, this is a very hot topic in a lot of areas about whether an infant should be breastfed or not breastfed. Is it good for their immunologic system and so forth? This may influence asthma, obesity, colitis, and even progression to autism. And so there's a lot going on with this as a developing area of study. One area of extreme interest here regarding all of this in the antibiotic use and diet is, how is the child feeding? When are the feeding times? Because as we all know, children's sleep in the early, especially first 3 to 6 months, is very different until they start to mature, until they start to quote unquote sleep through the night. This was an interesting study I read in The Scientist in August of this year, just last month. But also in the Journal of Physiology, they showed that infant microbiota actually begins at birth. And the mode of delivery now is a recognized factor. Now, this doesn't really apply to us as dentists, but it's an interesting phenomena because it's an initiating factor of the maternal signature, meaning that the mother's microbiota is going to have a direct effect upon the child's microbiota. C-section microbiome was closer to that of the skin, so there tended to be more staph and vaginal deliveries closer to that area, more lactobacillus. It also can impact brain development. It affects the hippocampus, which is responsible primarily for memory function and for memory consolidation. And the amygdala, which is at the lower part of the hippocampus, is for social behavior, fear, part of the limbic system as it's known. So there's a lot more to learn about the infant in terms of the microbiota as we develop. So in conclusion, the gut microbiome plays a role in our health and well-being. It includes understanding the association between the gut and sleep, particularly as it relates to our sleep fragmentation, total sleep time, sleep interruption, shift work and jet lag as it applies, and also to intermittent hypoxia and the reactive oxidative species that occurs. And this helps with our understanding of many of the aspects related to our sleep disorders. And a couple of the articles I showed you are actually appearing in the journal Sleep. One that's extremely interesting to me back a few years ago was an article that was entitled, "Is it sleep medicine or is it medicine during sleep?" And I found that to be very interesting because what the author's presumption was is that, we call it sleep medicine and we link all of these health-related consequences to sleep, such as cardiovascular disease, diabetes, high blood pressure, atherosclerotic disease, and so forth. But those are consequences that we recognize in the awake state. Are they different during the sleep state? And should we be studying those during the sleep state because it's more medicine during sleep? Well, that's true here. That's a very significant factor here, is that our gut microbiome is really a key factor in recognizing how it may impact not only our overall health, but how it impacts our sleep. So in the future, knowing what bacteria need to be identified to reduce risk for many of these health-related concerns, as well as our sleep and circadian rhythm, is going to be a critical issue. And now we view GI issues, hopefully, in a very different way. So I leave you with this scientific experiment on the National Alcohol Research Center, which says when you drink vodka over ice, it can cause kidney failure. If you drink rum over ice, it can affect your liver. When you drink gin over ice, it can affect the brain. When you drink whiskey over ice, it can cause cardiac problems. The conclusion was that ice is the cause and it's bad for you. So warn your friends about ice. It's bad. I thank you very much for your attention. I hope that this was enlightening. It was meant to be an overview, and I'll be happy to entertain any discussion or questions that may come about.